OBGYNs from right here in Chicago, and they're back with us today to answer some great questions from our viewers about women's health. So please welcome back Dr. J and Dr. I. Can you guess who's who?
Right.
Good luck, Dr. J, Dr. I.
That's right.
All right.
We're seeing double at home.
Exactly. You guys are very popular, so let's get right to it. My daughter has had multiple urinary tract infections, and it backs up into her kidney. They have only found multiple cysts on the kidneys and ovaries, and at one time, she almost went septic. Now the doctor wants to send her to the University of Chicago for more testing. What can or should we do?
Well, first of all, I would recommend that you go to the University of Chicago or some tertiary care hospital to figure out what's going on. But, you know, some simple things you can do: make sure you're drinking lots of water, cranberry juice, flush the kidneys out.
Wait, but not any cranberry juice, right? Not the ocean spray, like the...
Unsweetened. Yeah, exactly, unsweetened. And I tell some people, if you can't stand the taste, because some people can't, you know,
so bitter.
Apple, exactly. But some type of cranberry juice, unsweetened. That's good to flush the kidneys out. The cysts on the kidneys, the bladder, or the kidneys, the ovaries could be totally, you know, coincidental, but it could be a syndrome like polycystic kidney. So she should definitely go and get it checked out.
What about like cranberry pills? Does that help at all?
They help, but not as much as the juice. So if you just can't stand the juice, do the pills, but the juice is better.
The juice, yeah, the real deal.
All right, here we go. Here's the second question. My daughter could not get a correct diagnosis for the awful pain she had in her abdomen for years. It turned out to be endometriosis. Why did it take so long for doctors to diagnose her?
Well, endometriosis is a really tough diagnosis to make, actually. It's kind of what we call a great masquerader because, you know, endometriosis is when the tissue that normally lines the uterus is outside of the uterus. And it can be anywhere in the pelvis. It can be on the bladder, so it could mimic bladder symptoms. It could be on the bowel, so it could mimic bowel symptoms. It could be, even it's been documented in lung tissue, even in brain tissue. So it can literally be anywhere. And no matter it depends on where that tissue is. Getting tongue-tied here. The symptoms you have will depend on where the tissue is, basically. And so if it's on the bladder, you may think you have a urinary tract infection. If it's on the bowels, you may think you have irritable bowel syndrome.
And you can't see it on ultrasound or CT. That's the problem. You have to actually stick a camera in there and look. So it's really hard to diagnose just if someone comes in the office and tells you this is what's happening. So, you know, it's a difficult one.
All right, this is a really good question. After one's menstrual cycle stops, are you completely safe from becoming pregnant? Some women go a year and then the cycle comes back.
No, I tell my patients you are never completely safe until it's been at least a year. At least a year. You're not considered menopausal until a full year has gone without periods. At that point, you are pretty safe. But I noticed a person asked that, you know, it comes back after a year. If that happens, it could be that you're not in menopause, but if it's been more than a year without a period and then it comes back, you should see your doctor.
So if it does come back after a year and it's not menopause, what is it then?
Well, it's what they call postmenopausal bleeding. So it could be precancerous cells or cancer cells in the uterus. So you need to get that checked out.
Oh, wow. I didn't know that either. Oh, my goodness. We're learning a lot. Okay, here's a good one. Can we ask, what does it mean when you have a very weak orgasm? Is there something wrong with my body?
I bet that's anonymous. Somebody says it, it's like...
I mean, at least she's having one. Like, she wants to just start.
Exactly, that's the start. She's greedy. She needs to realize a lot of women don't have
I mean, but it's a valid question.
Yeah, it's a valid question, and to understand that, you have to understand what goes into the orgasm. And so the orgasm is really a multifactorial thing. There's a physical component with the pelvic floor. There's a hormonal component with the pituitary gland. There's even a psychological component. And so there are a lot of things you have to look at.
A lot of work.
No, a lot of work. It's a lot of work. And so certain medications can affect the nerves and how the nerves transmit feeling. And so
in the pelvic floor?
In the pelvic floor, exactly. Certain medications, diabetes, diseases like diabetes can affect the nerves. If you've had babies, the pelvic floor can be weak.
Yeah.
And that can cause a lack of sensation, basically, because you're not stimulating the proper areas.
So then does that mean she has to put this into work to make the faint go great?
Or, that's part of it. No, but that's part of it. Because a lot of times it's also psychological and social. You know, I tell people if you're worried about how you're going to pay your bills, for example, how you're going to pay the mortgage next month, you're not necessarily
stressed out.
You're not necessarily
focused on that.
Right.
You know? And a huge one that people don't think about, and I know this is daytime TV, but foreplay is a huge part as well. A lot of times there's not enough foreplay.
There you go.
Can I get an amen?
Every guy at home is watching going, that's not my wife. That better not be my wife.
All right, coming up next, more with Dr. We're just going to take a quick little break. We're going to have more with Dr. J and Dr. I. And then later, frankly, Hank has everything you need to know about the hottest show coming to town. We'll be right back.
Summer vacation warning. The hidden dangers in our national parks. Next, Inside Edition.
Today at 3 on ABC 7. This young lady has a connection with Jeopardy and one of our most famous contestants. Tell us about it.
Today, followed by Eyewitness News at 4. Now, an update from ABC 7 Eyewitness News.
Hey everybody, I'm Terrell Brown. Another hot and steamy day. Sounds about right since we are talking about summer here. It officially arrives this afternoon in a perfect beach day if you can get down to the lakefront. Let's check in right now with Tracy, get a look at the first alert forecast. Hey, Trace.
Hi there, Terrell. Yes, summer officially arrives at 5:34 this afternoon. But here's something we're keeping an eye on. And east over the lakefront, there you see, or out over the lake, I should say, central portion of Lake Michigan and over into southwest Michigan, we are watching a little cluster of some thunderstorms. So far, nothing has developed over land here on the Illinois side. But look at these temperatures already. 88 degrees right now in Oak Park, 92 degrees right now in Gary. You factor in that heat and humidity, feels like it's 91 Marseilles, 91 Coal City. Complete forecast, end of the show. Terrell.
Tracy, we're learning more this morning about what happened during the Orlando nightclub massacre just a short time ago. Investigators released transcripts of the 911 calls from the gunman. The caller identified himself as an Islamic soldier, but investigators do not think a foreign terror group directed the attack. During a news conference, investigators made a point not to name the terror group.
We're trying to prevent future acts from happening again, and for cowards like this one, people like that influence them, so we're not going to continue to put their names out front.
Investigators say they're almost done processing the shooting scene at the Pulse nightclub. Updating a breaking story that we've been following all morning, a deadly shooting on Lakeshore Drive near Balbo. The victim has been identified by family as George Morgan Jr. He was driven to police headquarters before being taken by ambulance to Northwestern Memorial Hospital, where he later died. Police say the shooting is gang-related, and Morgan was a known gang member. Other top stories that we're following on this Monday, 3-year-old Devon Quinn remains in critical condition after being shot last night while sitting next to his father. A bullet struck Devon in his shoulder. Police say the child was not the intended target. The Senate set to vote on gun reform measures today. The proposals are amendments to a spending bill and include the so-called no-fly, no-buy amendment. Another amendment will require law enforcement to be alerted when anyone on the terror watch list tries to buy a weapon from a licensed dealer. The first meeting is set tonight to update parents on how lead testing is going at Chicago public schools. So far, 26 schools have tested positive for high levels of lead. CPS is still waiting on results for hundreds of other schools. The first meeting is at 6 o'clock tonight at Mather High School. There are 6 others coming up this week. That is our news and weather update. Let's toss it back now to more Windy City Live.
On the air. All the things we talk about in commercial breaks. All right, we are back with Dr. J and Dr. I. They are answering your questions, our twin OBGYNs. So let's go to the next question here. What is the best route if you have fibroids? I'm looking for some relief.
And tell folks where fibroids are.
Okay, so fibroids are super common. They're just benign tumors in the muscle part of the uterus. And up to 80% of African-American women have them. Yeah. Very, very common. It really depends on what your symptoms are. If you're having pain, if you're having bleeding, if you are, past wanting to have children, there are medications, there are surgeries. There's surgery where you take the fibroids out and leave the uterus. That's more for people that want to keep their fertility. And then there's surgeries where you actually take the uterus out. So it depends on your age, if you want to have more babies, and how bad the symptoms are. So it's kind of a cop-out, but I would talk to your doctor. It depends on what your specific situation is. But there are a lot of things that can be done, so don't lose hope.
All right. Okay, with menopause, what's the best medicine to control hot flashes?
I hear those are so brutal.
Yeah, I mean, no, yes.
I hear it. Like, you can just be sitting here and this is like be...
No, the hot flashes, and they come on you quickly, because what happens is the blood vessels beneath the skin dilate, and so they will just rush, and that's why you get flushed, and since blood carries heat, you feel warm. And when our mother was going through menopause, literally, she would sit, the window was open, she had a fan in the window, and it was wintertime, and she's still baking. And so there are a lot of different treatment approaches you can take. There are hormonal options, medications that replace the hormones that cause the hot flashes, but you can only take those if hormones aren't risky for you. So if you have a history of uncontrolled high blood pressure, diabetes, cancers, you want to avoid them. But even then, you can go with natural alternatives. There's black cohosh. There are phytoestrogens, which are plant-based estrogens. There's even a medication, oddly enough, called clonidine, which is a high blood pressure medication, but the way it controls blood pressure is it affects the blood vessels, and so it prevents the blood vessels from dilating. You don't get that big rush of blood to the skin, so you don't feel the hot flashes. So a lot of options. It depends on your medical history and what you feel comfortable.
No natural remedies, though?
Well, black cohosh is one. Okay, yeah, absolutely. Right. And then you have these plant-based estrogens, soy, phytoestrogens. There's even a prescription one called Sinistin that's plant-based. So yeah, definitely there's some natural options.
All right, can a woman quickly stop her cycle? Is it even possible?
It is
I'm thinking like if you want to go on vacation or if you're getting married or...
That's what happens. Yeah, folks say, I'm going on vacation, my periods do, can I stop it? And the short answer is you can. Really any hormonal birth control, but primarily the pill. You know, when you take the pill, you have those 4 to 7 pills at the end that are not real medication.
Yeah, the placebos, right?
Yeah, and so that's just so people stay on track and have a period every month. But if you skip those and just take the active pills, you can do that for 3, 4, 5, 6 months and skip your period. Yeah. And that's what most people will do.
What age should you stop being on like the birth control pill?
It depends. As long as you are healthy, you don't have any contraindications, you can take it right on through menopause and even after. Some people will take it for hot
past the age of 35, there is a slightly higher risk of clotting disorders.
So if you smoke.
So if you smoke or if you have other risks for clotting, then over 35, you need to think about it.
But the thing is, the pill is, at any age, it's always less risky than pregnancy. True. So that's what you have to bear in mind. So.
For real.
Yeah.
Watching this segment, it makes me think about my twin brother, because you know, growing up, we wanted to be like pro athletes and firemen, and I'm just thinking, when did it come to you guys that you wanted, like, hey, we're going to talk about menstrual cycles, hot flashes, we're going to do this, man.
We were raised by a single mom, and we had very involved grandmothers, so from very early on, we heard about these things, so this is like right in our wheelhouse.
We got to take care of all of them.
All right, we got another question here. What can men do to help our women through the change?
Get out of the way.
Get out of the way. No, but you know, in all honesty, just know what to expect. I think if you know what to expect, you can be supportive of your partner. So know that you're going to have these hot flashes and they come on like that. Know that you're going to have the labile mood, so the mood's going to be up and down, and sometimes responses may not be logical, rational, what you'd expect, but it's part of the process, you know. Know that the libido's going to be decreased, so she may not always be in the mood, and she may not sleep well, you know. So just if you know to expect these things, and you kind of modify your behavior accordingly.
Be supportive. Don't complain if the window's open in the wintertime. If she says she's not in the mood, she's not in the mood. Just be supportive.
What age does menopause start? Like
average age for menopause is 51.2, but it's not considered abnormal after 35. So anytime after 35,
you could take your birth control up until 51.
You go. We have people who do. We have people
just to be on the safe side. Yeah, they do.
Absolutely.
Wow.
There you go. About 10 more years.
Some lucky ones go to 55, 56, though. So don't count your eggs yet.
All right. Dr. J, Dr. I, thank you guys so much.
Thank you so much.
Loving you're here. Head to our website for more on the twin OBGYNs and their medical blog, Twin Doctors TV. All right, later it is Money Saving Monday, and we've got some great dating tips that are fun and easy on the pocketbook. But up next, frankly, Hank is here. What do you have coming up, Hank?
It's Hamilton. Tickets go on sale tomorrow, and I'm going to tell you how you can get the hottest ticket Chicago has seen in decades.